My name's Simon Stretton-Downes. My wife Grace and myself have been working in Liberia now for nearly 5 years. Trinity Dental Clinic, this new incarnation, was opened in March 2019. The clinic started in the old hospital and that was knocked down in 2019, and we built the new clinic, which has been now open for 3 years. During that time, we've doubled the number of staff at the clinic. We've trained people to do tooth extraction, we've trained people to do hygiene, and we're able to provide a wide variety of dental services.
I've actually been here for about 18 months, and before I came here, I knew there were dental needs in Liberia, but my coming here opened my eyes even more to more needs than I expected. People come in pain. There are people who come and they feel that there's no way out, but at the end of the day, they are safe. They are out of pain, they are healed. While I was on Facebook, I was able to see a guy who was giving up and referring to a situation that he had been bewitched. And I thought this was not wish, it was a dental issue. So I asked one of the dentists to have a look at it. And then she agreed that it was a dental issue. From that point, she was able to contact Thomas on his Facebook page and was able to encourage him to come over at the ELWA hospital. And then he had a surgery where he was drained out, the pus was drained out of his face, and where the swelling was. And so right now, Thomas is doing okay, he's doing well. Now he knows that that was not because of wish. It was actually a situation that could have been handled. If he had not done that, he was going to die.
I want to give the Almighty God glory and for the Trinity Dental Clinic also, because they have been there for God and for this clinic, we have been their member now.
So we are grateful that we are able to be part of the problem solving that he needed.
But the needs are tremendous. The problems of dental sepsis caused by tooth decay, caused by broken teeth are massive. People can die from having a dental problem caused by swelling, infection, not to mention the pain and the chronic disease that follows.
For me, I have been trained to extract it basically and do just a basic exam. But through the Trinity Dental Clinic, I can proudly say I am where I am today. Someone who didn't know about teeth because we didn't receive the education then, but now at least can go about educating people about their teeth. Today, I can proudly say that through him, we've been able to touch many lives in this country. And we still believe that there are more to do. We have a radio program that is running. So every Wednesday I'm there educating people, talking about the basic dental care, things like when to brush your teeth, how to brush your teeth, when to visit the dentist, what to do and what not to do, and when they have dental problems, not to use the herb, not to go and see the country doctor and things like that, but rather find the dental clinic. Some folks say you can't take a last tooth out because when you take the last tooth out, you may run mad or some kind of bad thing might happen to you. So that is a complete wrong perception. So people come and experience that, okay, you can take the last tooth out and nothing can happen. And the bone, the bone chewing. It's a serious problem here. Like you chew bone, bone straight, they crack the teeth. Strong tooth, bone will crack it. People chew bone a lot. And we still in that struggle to provide the education for the people.
The new clinic, which we opened in March 2019, was funded by Samaritan's Purse as part of their building of the whole hospital. When the original hospital was moved here in October 2016, the dental clinic wasn't included in the phase 1 of the plan, and so phase 2 included developing the chapel and also the dental clinic. And so one of my first jobs when we arrived in 2017 was to come up with some plans to provide for this new facility.
I have been working with the dental clinic here at ELWA since 2009. A very decent place. People always come and they marvel about the clinic. A very clean place, set up well. I've been doing this job like 9 years. I've been doing hygiene, and we are always things that we can't understand, even though we're always learning every day, and that a sermon will always come in. And we have been happy working with him. We tell God thank you for that the sermon so much. We love the job, and at the same time we put Christ first. We put God first in our job.
It was very exciting in August 2018 to have Eddie McQuee break the ground for the new building using land on the ELWA site that was just a wasteland, just a sitting there, empty place. And Eddie broke the soil. He then set off to go to Nairobi to train as a dentist, and construction began, which took 6 months. During that time we ordered equipment from Europe and from America, which was fitted into the new clinic. This was opened in March 2019. We then had an official opening in May, where the Vice President of Liberia came and cut the ribbon, and we formally opened Trinity Dental Clinic in the new phase. The Vice President has agreed to be the patron for the new dental therapy training school. We're very excited about that, and we're really looking forward to seeing what develops in the coming years.
Through the training of Dr. Simon, I first started at the clinic as a volunteer, came in 2017 to work as a volunteer and found pleasure of being a dentist. So right now I am trained to become one of the dental practitioners now in the clinic. In Liberia we need a dentist because we are short of dentists, and we need to go out there to the rural area because we have dental need.
So also over the last 2 years we have been embarking on a number of outreach trips, taking our team out into the rural communities to try to meet dental needs. And these have been well received, but of course they're very limited in their effect. I mean, last July we went up to Voinjima on the NAF plane, and over 3.5 days we treated over 150 patients, taking out over 340 teeth.
I mean, it's good because you have a lot of people who come for dental need, and in such an environment there's no dental health care, there's no oral health care. So having patients like this, meeting the needs of them, I mean, it's so interesting seeing people, helping people with dental problem, with tooth problem. That makes it interesting.
But the problem is that as soon as we leave, the service stops. How much better would it be if there was somebody working in Voinjima all the year round to provide dental care? And that is the vision that we want to take to the next level here at Trinity Dental Clinic.
So I worked as a dental assistant for about a year. Simon started training me to do extraction, and well, it was good. He's a really great teacher, and I learned a lot, and I have been learning ever since. Then after a while, he started talking about sending me to dental school. Like I said earlier, it has been my dream since I was in the 3rd grade to be a doctor. Honestly, to be a medical doctor, but then when I started doing dentistry, I think I fell in love with dentistry more than general medicine, and I have seen the difference that just a simple extraction can do in the life of a person. And as someone comes in so much pain and you're able to do something, they are leaving smiling. So I graduated from the University of Liberia in 2017 with a degree in biology and chemistry. But it would be really nice to be a qualified dentist in Liberia because we don't have that many, and hopefully in the nearest future I can enter into dental school to become a qualified dentist and just to help more Liberians and to put dentistry on the map in Liberia.
I have been here from the day the clinic opened, 2008, up to the present. The reason for which I love the work is that we are helping God's people. And it is God that inspired us to do such a job.
So behind me here you can see Trinity Dental Clinic, which was opened in March 2019, and the space immediately behind me is where we anticipate the new dental therapy training school sitting. This will be constructed as a 2-story building with, on the ground floor, 6 dental clinics and a waiting area, and on the first floor we'll find classrooms, office space and changing facilities. We're really looking forward to raising the funds for this and being able to see this building take shape so that this empty space can become the place to build a future for dentistry in Liberia.
I studied dental medicine in Philippines and got qualified end of 2019, and I came to Liberia, started my internship year at ELWA. I have been working along with Dr. Simon, also learning new things, because in Liberia the situation is totally different from what you see outside. You have cases like broken jaws, you have trauma, different trauma cases, you have very large swellings, and there are a lot of difficult cases here in Liberia because most often people here don't even know how to prevent dental decay, and most often they come at the hospital when it's already in the last stages.
The last year we have been planning to open the Liberia Dental Therapy School, and this will train people to do extractions, to teach community dental health, to do temporary fillings, to do scalings of teeth, to examine, diagnose, refer, treat where they can. And this will be a 2-year course sponsored by Cuttington University, and they will provide the diploma supported by friends at Plymouth University in the UK, so that we can offer a 2-year course that will allow them to be academically qualified and then subsequently registered with the Liberia Medical Dental Council to produce graduates who can then work in the rural communities as qualified academically and medically registered, so that they can meet the needs in the rural communities in the coming days.
There's a lot of need for oral health. People need to be taught, people need to be trained, and that is why we see it as a need to open even a therapy school that will be starting September of this year. I want to say a big thank you to Dr. Simon and all of our partners who are very instrumental into having this happen.
We're hoping to open in September with 4 students. Once we've built the new building, we will be able to expand the number of people that we take on, and so that potentially we could take 6, 8, 10, even 12 students each year. So that's the next level that we're aiming for here at Trinity Dental Clinic, and we hope that you will be able to take part and support us in this new venture.